All right, guys, part 2 on the back pain series. Part 1, I'm going to pin it to my post. Part 1 was on surgeries and the risks that go along with that. Part 2 is going to be on conservative treatment, and we're going to kind of compare it to the surgery, at least for studies in the first part. And then we're going to get into what is conservative treatment. So that's going to be our question today that we answer is what is conservative treatment? Okay, so 1, long-term improvement was not better after fusions compared to cognitive intervention and exercise. That's a big deal, right? So one exercise, we'll get into that for conservative treatment, but also cognitive intervention. That means that the language that they use, the doctors and things that you read online, can be scary and can ultimately cause fear and panic, which is gonna heighten your pain sensitivity, right? So it means that as humans, we're not fragile, right? We wouldn't have made it this far if we were. So when they start like can't lift over 10 pounds, can't squat, can't deadlift, can never move again, ultimately that language is going to contribute to your pain, right? So understanding that it's okay to move, it's good to move rather, and that you don't have to be scared of movement, okay? So that thought alone can go a long way when it comes to pain. 2016 study, no statistical benefit for surgery compared to non-surgery for spinal stenosis, okay? So again, just no statistical benefit, right? All right, 95% of disc herniations occur at L4, L5, L5S1, right? So those two areas are the most common, 95% worth. Mine was L5S1. I had nerve pain all the way down my leg. I had nerve pain for about 18 months. My journey from pain to no pain was about 2 years, okay? Obviously, I chose not to do surgery, but that was the length that it took, okay? In disc herniations, surgery provided faster relief in short term, okay? So surgery is gonna take away your pain faster, but did not show a benefit over conservative treatment mid to long term, okay? So again, that's pretty important. And we talked about in part 1 how 50% of all surgeries lead to a second surgery. So obviously the long term of surgery isn't the best either, right? Because again, you need to learn how to move, and we'll kind of get over, we'll talk about that. 5, lumbar disc herniations can be absorbed without any surgical treatment. So if you're struggling with a disc herniation, I remember for me, this was a really big one. I was blown away that they could reabsorb, right? It's like 66% of disc herniations reabsorb. So, and it's without surgical treatment. That should be, if you're struggling with a disc herniation, that's a really big deal, and is, in my opinion, a game changer, right? But I think there's no studies and they don't really understand why that's occurring yet. I have my thoughts on it after gone through it, but they're not sure what kind of triggers that reabsorption, okay? So, what is conservative treatment? I remember when I was struggling with my disc herniation, this was the question that I wanted answered because I was reading like those same stats that you just read, but I couldn't find anywhere that was telling me what conservative treatment meant. And even in the studies, conservative treatment there's not like a one standard, there's multiple different ways that people kind of treat that conservative thing. So for me, back in the day, 2019, I was lucky enough to find a guy named Andrew Dettelbeck. His IG handle is the shirtless dude. And he was the first person talking about, well, one, he healed a disc herniation, but he was talking about moving in a way so you weren't contributing to your pain, okay? And then understanding that we can be moving that is going to affect how much pain we're in. So for the low back, I believe if you have chronic back pain, and especially if you have nerve pain, you have to figure out what a neutral pelvis is, right? Especially with how we live today in our modern lifestyle where we're on the computer or we're on our phones or we're like almost always in a constant state of flexion. We have to understand where a neutral pelvis is. So what that looks like is if I tuck my butt under, posterior pelvic tilt, and then I put my butt towards the ceiling, right? Anterior pelvic tilt, finding the middle between those 2 points, right? So this is what I'm saying neutral is, and then just slightly bracing my ribs on top of that, okay? So I'm saying this is good body alignment. There's a lot of people on social media right now that say body alignment doesn't matter, but I can tell you if you're struggling with a disc herniation or back pain in general, alignment matters, okay? So finding neutral and then moving throughout your day and maintaining that position. So the interesting thing here is if I go to hinge, right, I'm putting my butt towards the wall behind me, I need to shift my pelvis to an anterior pelvic tilt so my spine stays neutral. If I don't shift it, right, I go into flexions, right? So your lumbar spine doesn't have to do whatever it is your pelvis is doing. The goal is to move your pelvis in a way to keep your lumbar spine neutral. And that's gonna give your back a break and give it time to heal, right? So finding neutral is super important. And then learning how to maintain neutral in all your day-to-day movements. I built a whole program around that because it's a lot more challenging than you think. And there's gonna be tons of times when you don't realize that you're moving in a way that's contributing to your pain, okay? So next, so we talked about the kind of the healing point, right? Or what we need to do to give our back a chance to, or give our back a break, right? But we also need to talk about why it happened, okay? So the whole body's connected. That's why, like, yes, we can talk about the low back. Yes, we can talk about maintaining neutral to get things healing, but we also need to talk about our movement in general, right? What's our ankle flexion look like? What's our knee flexion look like? Hip extension, hip flexion, external rotation, internal rotation. All of these things are gonna contribute to the way that you're moving in your day-to-day. So learning that you need good dorsiflexion so your knees can go over your toes, which means that when you go to squat, your pelvis will be able to stay, or your lumbar spine will be able to maintain a neutral position as you squat. All those things matter, especially if you're dealing with pain. So understanding that, yes, we need to move in neutral, and that's gonna give us some relief right away. But ultimately, we need to figure out what imbalances caused it to happen in the first place, right? Again, that's why I built a program. It's a full body program because you don't know what part of your movement is contributing to why that happened in the first place, okay? So yes, neutral to heal, then start building from the ground up, learning what your ankles are doing, knees are doing, hips are doing, all of that. Even in the upper back, thoracic spine can play a huge role in your lower back pain, okay? So it's a full body deal. It's not just this neutral thing. That's kind of a right now to get things healing, because if you're in pain all the time, you kind of feel like you're going nuts. And I remember that, where I was like, I'm going crazy because I just don't want to be in pain anymore, okay? So neutral, then start figuring out what's going on in the whole chain, okay? Part 3, we'll talk more about that, more about flexion, extension, and building strength once you're symptom free, right? So once you understand where movement is, where neutral is, then you can slowly start building into flexion, slowly start building into extension to kind of, I hate the term bulletproof, but kind of bulletproof you to make sure that it doesn't happen again, or it's less likely to happen again, okay? So I hope this helps. Again, message me if you have any questions. I try to get back to DMs within 24 hours. That's the whole aim, is just to help. So again, let me know if you do have any questions. And part 3, I will release next week.